Welcome back. This is part 3 of BIAV's advocacy webinar series, and today in this section we're going to talk about how a bill becomes a law. I don't know how many of you have read any of Malcolm Gladwell's books, but he's a really interesting author. He calls himself a cultural anthropologist. And in his book called The Tipping Point, he talks about how things become big in the culture. You know, what is it that makes Vans sneakers so popular among a certain group of people? One of the quotes from that book says, in order to create one contagious movement, you often have to create many small movements first. And that's sort of where we are in the brain injury community. We've been trying for, about 40 years now to create all of these little movements that have improved the system of care for people with brain injuries. In the state of Virginia, we have basically two processes that we engage in as part of the legislative process. One is making bills and one is budget amendments. And we're going to talk about budget amendments in the next session. But today, in this session, we're going to talk about how a bill becomes a law. So in the 2020 General Assembly session, BIAV and the Virginia Alliance of Brain Injury Service Providers, which is made up of state-funded brain injury providers from across the state, worked together to create a bill that was going to require crisis intervention teams to receive some training on brain injury. These crisis intervention teams, when you call 911 and somebody's in a crisis, these are the people that respond. And sometimes, as you know, it helps if those people have some understanding of the people that they're going to be dealing with. They had absolutely no requirement to have any training about brain injury, and we thought that needed to change. So we created this bill request. You can see up top where it says what. This is what we wanted to do. This is the outcome that we wanted. Next, it says patrons and bill numbers. To have a bill introduced in the General Assembly, you need a sponsor, also known as patrons. We got Delegate Tony Wilt from the House of Delegates and Senator John Williams from the Senate of Virginia, both to introduce this bill in their respective houses. And you'll see in just a second why that's important. We also created in this needs statement a list of why this legislation needed to happen. And you can read those things, but a lot of it comes down to the fact that there are an awful lot of people with brain injury who somehow get involved with the justice system and who very often are having some sort of crisis that may require the crisis intervention teams to show up. And we just, like I said earlier, thought it was really important that they have some understanding of brain injury. So we got Delegate Wilt and Senator Edwards to introduce these bills. Now, this is a big old chart, and I'm going to try to explain it to you fairly clearly. You see over there in the yellow box, the bill is introduced in the House of Delegates and or the Senate, which is known as the House of Origin. Through a process in each house, the bill is heard in committee and it's either passed or defeated. If it's passed, you can see that it goes to the other house. So, for example, when Delegate Wilt's bill was presented in the House of Delegates, it was heard in several committees and it was passed. And then it went to the full House of Delegates and they voted to pass it. If the bill is passed by one house, it gets sent to another house. So if it's passed in the House of Delegates, it goes to the Senate for them to review. If it's passed in the Senate, it goes to the House to review. It's just another layer of review and research to make sure the bill is not going to have any unintended consequences. If the bill is communicated to the other house, like from the House of Delegates to the Senate, and it is passed by the Senate, then that bill is communicated to the governor. Of course, it could be defeated by the other house, and that's another time when the bill goes dead, basically. But if it's communicated to the governor, you can see that there are three basic actions. The governor can approve the bill as is and sign it. The governor can veto the bill, or the governor can approve the bill with amendments. If the governor makes amendments to the bill, that bill goes back to the House and Senate. The amendments can either be rejected or agreed to by one or both houses. If it's not agreed to by the House and Senate, then it's probably going to be vetoed again by the governor. But if the amendment is agreed to, then it's likely to be approved by the governor, at which point it becomes law. If the veto is overridden by the House and Senate, then it does not become law. And that's sort of how a law happens in the state of Virginia. This is a pretty complicated process, and there are all of these minute little steps that are involved in it, but by and large, we know that it's a very standard process, and advocates watch those bills move through the committees and the House and the Senate, and we make sure at BIAV to keep everybody that's working with us to see this bill passed is updated frequently. As I said earlier, in part 2 of our series, we were very lucky that this bill was passed by the General Assembly last year, and BIAV is currently working with the Department of Behavioral Health to create the training that law enforcement and first responders will get to help them understand a little bit more about brain injury. And so that concludes section 3 today, and the next section is going to be on how budget amendments happen. Thanks for watching.